let's talk about sleep and its importance. Now, what are sleep disorders? I have to go a bit medical on this whole talk. So what are sleep disorders? Sleep disorders are a group of conditions that disturb normal sleep patterns. And it's one of the most common clinical problems which all of us encounter at various stages of life of patients who come to us, various ages. It's inadequate or non-restorative sleep interfering with normal physical, mental, social, and emotional functioning. Sleep disorders can affect overall health, safety, and quality of life. Now, before we go on to sleep disorders, let us understand what is the sleep cycle. The sleep cycle has the REM, the rapid eye movement stage, and the NREM, that is the non-rapid eye movement stage. And NREM is subdivided into N1, N2, and N3. N1 is the initial sleeping period when you're just falling asleep. N2 is the light sleep, which constitutes almost a major part of your sleep cycle. N3 is the deep sleep. And REM is the time before you just get up, and that is the vivid dreaming stage. Now, if you talk about sleep stages in a normal sleep station and its functions, stage 1 is NREM 1. It constitutes about 1 to 7 minutes and 2% of the nighttime sleep. The body is not fully relaxed, though the body and mind begin to slow. It's easy to awaken people at this time, but when they go into deeper sleep, they can move into N2 very easily. Now, N2 constitutes about 10 to 25 minutes. It constitutes 50% of your night sleep. The body is more relaxed with decreased temperature, relaxed muscles, slowed breathing and heart rate. Brain is more relaxed, stop in-eye movements, and difficult to waken up at this time. Maximum time is spent in N2. N3 constitutes about 20 to 40 minutes and constitutes about 20 to 25% of the night. It's a deep sleep. Muscle tone, pulse, and breathing rate are decreased. Brain activity has delta waves, which are the SWS or the slow wave sleep on EEGs. Essential for restorative sleep, it helps in insightful thinking and memory. Stage 4 is the REM sleep, which constitutes 10 to 60 minutes, 20 to 25% of the night. The brain activity picks up, nearing levels seen when you're awake, essential to cognitive functions like memory. Vivid dreams also occur in this phase. Body experiences atonia with two exceptions, the eyes and the muscles that control breathing. Even though the eyes are closed, they can be seen moving quickly. You do not enter an REM sleep until you've been asleep for about 90 minutes. This is not moving. Okay, now sleep cycles through the night. You find that there is REM.
Madam, make it a full screen again.
Sleep cycles through the night. Around 10 p.m. if you sleep, then it starts with the N1, then goes on to N2, N3, and then REM. Then again, the whole cycle is repeated. And you find that as the night progresses, the N2 increases, the N3 decreases, REM starts increasing, and by the time you wake up, the REM is the maximum. Now, what are the importance of sleep stages? Why I have told you all these, that each stage is important. They are because they allow the brain and the body to recuperate and develop. Failure to obtain enough of both deep sleep and REM sleep may explain some of the profound consequences of insufficient sleep. Sleepers who are frequently awoken during early stages, such as people with sleep apnea, may struggle to properly cycle into these deeper sleep stages. People with insomnia may not get enough total sleep to accumulate the needed time in each stage. Now, each stage is important. So what affects the sleep stages? Age. Newborns spend far more time in REM sleep. That is why a lot of my youngsters, when I was speaking to them about this, they said, we wonder why babies are constantly, fluttering their eyes or constantly making sounds, because they have vivid dreaming at that time. That is the REM stage. As they get older, their sleep becomes similar to that of adults. Recent sleep patterns. If a person gets irregular or insufficient sleep over a period of days or more, it can cause an abnormal sleep cycle. Alcohol. This can definitely alter the sleep architecture. Alcohol decreases REM sleep early in the night, but as the alcohol wears off, there is an REM sleep rebound with a prolonged REM stage, which is not good for the body. Sleep disorders like sleep apnea, restless leg syndrome, and other conditions that cause multiple awakenings may interrupt a healthy sleep cycle. Now, there are multiple organ systems involved in sleep. Transitions between sleep and wake states are influenced by multiple brain structures, including the hypothalamus, which controls the onset of sleep, hippocampus, which is the memory region active during dreaming, the amygdala, which is the emotion center active during dreaming, thalamus prevents sensory signals from reaching the cortex, reticular formation regulates the transition between sleep and wakefulness, and pons helps to initiate REM sleep. The extraocular movements that occur during REM are due to the activity of the PPRF. Average sleep needs, what one needs are the newborn requires 16 hours, 2 years it is 12.5 hours, 10 years it is 10.5 hours, teens it is 9.5 hours, and adults it is 8.5 hours. Now, this is very important to understand the circadian rhythm of the body, which is the biological clock of the body. The suprachiasmatic nucleus, which is the body's master circadian clock, and the sleep-wake homeostasis. Now, there are a lot of peripheral clocks, which are very important. These clocks are the circadian rhythms, and each of these, the muscle, fat, liver, and pancreas, work opposite to each other during the day and the night. And that is a very, very important aspect of the biological clock. Now, circadian rhythms round the clock, it is so important. Like in all my PCOS patients, in my menopause patients, I explain about the circadian rhythm. And a lot of teens, I tell them, you are so Google savvy, go and read about the biological clock. Then you understand what your wrong sleep timings are doing to your body. Like melatonin is our sleep hormone. It starts secretion around 9 o'clock. When everything, the body goes into a sleep mode where it requires rest to take out wastes of the body. And lowest body temperature is at 4:30. At 6:45 is the sharpest blood pressure rise, because that is when your REM sleep is there and you're waking up. And 7:30, the melatonin secretion stops. And all these kids who are sleeping late, maybe at 2 o'clock and all that, half of their melatonin secretion has gone waste, and gradually the melatonin secretion stops and they can't fall asleep later. So melatonin is the night hormone. It inhibits SERT, which is the sodium-dependent serotonin transporter. Serotonin derivative is highest during the day and lowest at night. This is your waking hormone. And bright light inhibits melatonin production. That is why all these people who are on mobiles, on the TV, just before sleeping, they are inhibiting their melatonin secretion. Now, when you look at them, this is just in brief, the International Classification of Sleep Disorders. Basic thing is insomnia, sleep disordered breathing, central disorders, circadian rhythm, sleep-wake disorders, which are there in most of the youngsters today. Insomnia exact cause is not unknown. Forget the etiology, because let's hurry up. Now, only the circadian rhythm sleep-wake disorders, which are very common in youngsters today, the environment is not well aligned with the internal circadian rhythm because of shift work and jet lag. These are two important things which are very, very present today. Now, clinical presentations in insomnia, they may present as a difficulty in falling asleep and or staying asleep. Patients report taking 30 minutes or more to fall asleep or spend 30 minutes or more awake during the night. Presence of compromised day function, fatigue, daytime sleepiness, poor attention, increased accidents, aggression, reduced motivation or energy. These conditions should last for at least 3 months and thrice weekly for it to be labeled as insomnia. Early identification is crucial, requires a low threshold for suspicion. Clinical features that predispose, precipitate, and perpetuate insomnia should be identified from the history itself. Hypersomnia is disabling excessive daytime sleepiness. They find it difficult to maintain alertness during significant waking hours, with sleep occurring unintentionally or at inappropriate times that interfere with the daily routine. Today itself, I had a patient who was waking up at 6 o'clock, sending children to school, again sleeping at 7 to 9, then again sleeping from 4 to 6, and then finally going to sleep at 2 a.m. Many patients describe a considerable impact on their cognitive function, calling it a brain fog. Evaluation, let's forget it now because we are running short of time. Only the laboratory tests are important: the arterial blood gases, the thyroid function, drug and alcohol toxicity screening, iron studies, because anemia also causes insomnia. Now coming to treatment or management, the most important are the non-pharmacological management, which is cognitive behavioral therapy for insomnia. It includes a set of psychological and behavioral techniques specific to treating insomnia. Then sleep restriction therapy. This limits the total time allowed in bed to increase the drive to sleep. A lot of people have a TV in their bedroom, so all their TV watching is done from the bed, all their reading is done in bed. So all the things which are not sleep related are being done from the bed. So the bed is used for a lot of things, not only associated with sleeping. Then stimulus control therapy helps change sleep habits so that the patients don't have difficulty in falling asleep. Patients should not go to bed until they are sleepy. Also, the bed should be used only for sleeping and not for watching television or reading books. You can have a comfortable chair close by where you're reading a book, but don't read on the bed. Then relaxation techniques may be implemented before sleep. Meditation, breathing exercises are some of the relaxation techniques. We even say Bhramari Pranayam helps, sitting in Vajrasana helps, and a bit of meditation. Maybe just, like people say we can't meditate. Okay, just tell them to count back from 100 to 1. Then sleep hygiene, a set of education about lifestyle and environmental factors like light, noise, temperature that may interfere with sleep. Like for children, we tell them, okay, now change to your night suit, go to the washroom, brush your teeth, come back, lie down, go to sleep. One routine is followed so that they follow for falling asleep. Pharmacological, I'm not going into all this, only melatonin receptor agonists. A lot of jet lag people start taking melatonin, which is used in circadian rhythm sleep disorders, jet lag, and delayed sleep-wake phase cycle. Now, deterrence and patient education. Advice should be given to the patients to practice good sleep hygiene, maintain a regular schedule, that is, go to bed and wake up at the same time every day. Don't keep too much of a gap between weekdays and weekends. A lot of people say weekends we get up at 11 o'clock. Other days we get up at 6. This gap should not be so much. Use the bed for sleep only, as I told you. Exercise almost every day, but not right before bedtime. Avoid caffeine or smoking mainly during the evening. Maintain a dark, calm, and quiet environment in the bedroom. It's even said that when you go to the washroom at night, don't switch on the bright light. Have a dim light on, but don't switch on the light because that shifts your circadian rhythm further forward. That means you sleep out later. Avoid struggling to fall in bed. If you can't sleep, get up, try again later, or change the bed. Also, if the patient takes sedative or hypnotic medications, this should be documented in the medical record, and patients should be counseled to avoid driving and operating machines when under these medications. Now, differential diagnosis is post-traumatic stress disorder, depression, anxiety, bipolar disorder, opioid abuse, alcoholism, abuse of stimulants such as amphetamine, chronic obstructive pulmonary disease, or hyperthyroidism. And common risks and complications are increased likelihood of accidents, development of serious complications, mood disorders, anxiety disorders, false memory, decline in thinking abilities, risk of stroke in those with periodic limb movement sleep disorder, and ongoing untreated obstructive sleep apnea could lead to heart problems. Let's wish each other a happy sleeping. Thank you.